Hi, my name is Imelda Williams. This is the feedback on the practice bank that I gave you for the shoulder. Please have your preliminary image evaluation form at hand that you've completed and mark it as you go along and listen to the video feedback. So for case 1, we have a patient who fell onto his right shoulder during a rugby match. So if we look at the AP view, we can see that the humeral head has been displaced inferiorly and anteriorly. And on the Y view, we can also see the position of the humeral head, which is inferior and anterior displaced. So for the PIE form, you should indicate that it's abnormal. And then, oops, sorry for that. So the normal appearance is abnormal. The alignment, of course, is abnormal. And because it affects the glenohumeral joint, your cartilage and joint is abnormal. And the overall comment should be anterior dislocation of the glenohumeral joint. For case 2, we have a young patient who fell off a bike and now has a painful arm from the shoulder to the elbow. So if we look at the AP view, we can see that the humeral head has slipped, and on the lateral, the Y view, we can also see that it's angled forward. However, it doesn't really affect the glenohumeral joint. So for case 2 then, it's abnormal, and then the alignment is abnormal, the bone is abnormal, and also your overall comment would be that there is a slipped humeral epiphysis, and this is very typical of a Salter-Harris type 1 fracture. So for case 3, we have a patient who's been in a car accident and now has a lot of pain over the scapular region. So if we look particular at the scapula, it's quite obvious that there are fractures, so there's comminuted fractures through the scapula. But in addition, there's also a fracture of the clavicle, and there is some mild displacement of that fracture. So for case 3 then, again, it's abnormal. The alignment is abnormal. The bone is abnormal, but the glenohumeral joint is preserved. So your overall comment is that there's a comminuted scapular fracture as well as a distal clavicle fracture with some mild displacement. So moving on to case 4. So this patient has got chronic right shoulder pain, and so there's no injury, it just says exclude pathology. So if we look overall at the shoulder, we can see that the alignment, the joints, there's no fractures there. However, we can see that there is a calcification, and that calcification sits within the supraspinatus tendon. So for case 4 then, it's abnormal, and the only other tick box is for the soft tissue, and your overall comment there should be calcification of the supraspinatus tendon. Then moving on to case 5. And this is a patient who was intoxicated and fell and now has a deformed right arm. So when we look at the humeral head, we can clearly see that there's comminuted fractures, which is at the level of the surgical neck, and there's also a medial displacement as well as rotation of the fracture. And this we can see on this view as well. However, when we look at where the humeral head is placed, it's still within normal alignment. So then overall for this case, it's abnormal. There is some, because of the rotation and medial displacement, the alignment is abnormal, and of course the bone is also abnormal. Your overall comment should be that there is a comminuted fracture through the surgical neck of the right humerus with medial displacement and rotation. However, the glenohumeral joint alignment is normal. So for case 6, this is a patient who fell from a tree and now has shoulder pain. So if we look at the AP view of the shoulder, here we can see there's our epiphyseal lines, which is intact. However, there is a fracture of the humeral diaphysis. This is just below the surgical neck, and you can see that there are multiple lucent lines here. So it's a comminuted fracture. And again, on the Y view, we can see that the humeral head is intact. So on our form then, it's abnormal. The bone is abnormal, and the overall comment is there's a comminuted fracture that involves the proximal humeral diaphysis just below the surgical neck. However, the glenohumeral joint is preserved. So for the final case in this practice bank, we have a patient who has chronic left shoulder pain, so there is no history of trauma. If we look at the shoulder joint, we can see the typical hallmark signs of osteoarthritis with sclerotic appearance. There's osteophyte formation, and there's also joint space narrowing. So for this case then, it's abnormal. The bone is abnormal. The cartilage and joint is abnormal. So your overall comment is osteoarthritis with typical hallmark signs of sclerosis, osteophytes, and joint space narrowing. Thank you.